had a triage system which we were operating for people who telephoned into the surgery. Patients who walked into the surgery were being offered appointments in a bit of a ad hoc way, and requests that were coming to us by email were eventually being processed, and we were trying to deal with it. So we thought that it was just not equitable, and the person who shouted the loudest tended to get the more immediate treatment. So once we chose the Accurx tool, we attended. I and a couple of my staff looked through the information that was on your website and stepped through it a few times. We realized that it was quite easy. We chose a date to go live with this, and then we just sat down with all the team, stepped them through one or two tests, and because it's such an easy system, it didn't require a lot more than that. So then we just chose a date in which we went live and turned it on and went from there, and we were surprised at actually how easy it was to use and how quickly the team took it on. The two main changes are that patients are now filling out, a lot more patients are filling out the form on themselves. We find that helps us because it removes the subjectivity of a receptionist trying to interpret what a patient is saying and then put that down onto the system for the clinicians to review. A slight benefit to that is that I think when the patient's filling out the form themselves, sometimes they sit back and think, well, hang on a minute, do I really want to raise a request for something so trivial? So, but that is more anecdotal. The other main change that we found, which has been really helpful, is that because the patients have now realized that regardless of what time of the day they contact us, they'll be treated in exactly the same way. We found that our call volumes have begun to level out during the course of the day. So whereas historically we would have big peaks at about 8 o'clock and then again about lunchtime, that is beginning to even out a lot more, and less calls coming into reception. So those are the two real big advantages for us. From a clinician's point of view, they are really pleased with the reception flow because we're capturing information in a standard way. We're asking the same questions of the patients, which on previous systems was inconsistent. So that helps them to more quickly and effectively decide what treatment is required.